In the United States, Canada, the United Kingdom, and Australia, millions of people suffer from nighttime leg cramps, exercise-induced cramps, or random, painful spasms that disrupt their daily lives. Preventing leg cramps starts by addressing critical vitamin deficiencies that directly affect muscle function, nerve signals, and hydration levels. Vitamin B1, also known as thiamine, plays a crucial role in muscle and nerve communication. Yet it's one of the most overlooked vitamins when it comes to leg cramps. In the United States, diets heavy in refined carbohydrates, sugary foods, and alcohol severely deplete thiamine levels. This leads to problems with neuromuscular coordination. Basically, your nerves fail to send clear signals to your muscles, and cramps happen more frequently, especially at night. Many people report feeling restless legs, twitching calves, or sharp tightening in the feet after a long day, and these are often early warning signs of B1 deficiency. Clinical observations from hospitals in the United Kingdom have shown that older adults and patients recovering from surgery frequently suffer from severe cramps until their B1 levels are restored. In Australia, thiamine supplements are now often used in rehabilitation settings, especially for people with chronic fatigue, nerve pain, or cramping related to diabetes. In Canada, patients experiencing alcohol-related neuropathy are almost always placed on high-dose B1, not only to improve nerve healing, but also to stop the muscle contractions that make sleep almost impossible. What's heartbreaking is that many people in the United States are prescribed pain relievers, muscle relaxants, or even anti-anxiety medications for leg cramps, when in fact their problem could be a simple vitamin B1 deficiency caused by years of eating nutrient-poor processed foods. Vitamin B12 is essential for healthy nerve conduction and red blood cell production, both of which directly impact muscle performance. A deficiency in B12 can cause misfiring nerve signals and poor oxygen delivery to muscles, which results in frequent leg cramps, numbness, tingling, and even muscle weakness. In the United States, B12 deficiency is more common than most people realize, especially among adults over 50, those with digestive disorders, and people on medications like metformin or acid reducers. Canadian data shows that vegetarians and vegans are especially prone to B12-related cramps because this vitamin is found almost exclusively in animal products. In the United Kingdom, neurological clinics regularly test for B12 when patients complain about muscle twitching, calf pain, or night cramps that won't go away. Vitamin B12 shots or sublingual supplements often bring immediate relief in these cases, especially when low levels have gone undetected for years. In Australia, it's common practice in functional medicine to evaluate methylmalonic acid levels, a more precise indicator of B12 status, especially when symptoms like leg cramps persist despite hydration and electrolyte intake. What's tragic is that thousands of Americans are told they just aging when their legs begin cramping, twitching, or locking up, when the real issue is that their body is crying out for a vitamin they no longer absorbing efficiently. And even more disturbing, this vitamin is often ignored entirely during regular checkups. Vitamin D is well known for bone health, but its role in muscle contraction and nerve signaling is just as critical. In the United States, more than 40% of adults are estimated to be deficient in vitamin D, especially those who live in northern states or work indoors most of the year. Muscle cramps, particularly in the legs, thighs, and feet, are one of the early symptoms of low vitamin D, and this has been confirmed by numerous studies from Canada and the United Kingdom. In fact, researchers in Toronto found that supplementing with vitamin D significantly reduced the frequency of muscle spasms in elderly patients and improved their mobility. Vitamin D helps regulate calcium and phosphate levels in the bloodstream, which are essential for smooth muscle function. When D levels are low, calcium metabolism suffers, and the muscles become overexcited, leading to painful spasms and cramping, especially during rest or while sleeping. In Australia, where sunlight is abundant, it is still shocking how many people test deficient in vitamin D due to sunscreen overuse or indoor lifestyles. In the United States, despite aggressive awareness campaigns, many people still aren't getting regular vitamin D testing. Meanwhile, leg cramps are being misattributed to dehydration, overexertion, or even anxiety. Vitamin D3 supplements, ideally paired with vitamin K2 to direct calcium properly, can transform the lives of people suffering from unexplained muscle tightness and spasms. Yet most aren't even aware that such a basic vitamin could be behind the pain keeping them up at night. Magnesium is technically a mineral, but its role is so critical in preventing leg cramps that it deserves to be discussed alongside vitamins. Magnesium is involved in over 300 biochemical processes in the body, including muscle relaxation, nerve transmission, and electrolyte balance. In the United States, magnesium deficiency is considered widespread due to soil depletion, processed food consumption, and chronic stress, all of which drain the body's stores. Low magnesium levels cause the muscles to remain in a state of contraction, which is why people often wake up in the middle of the night with their calf clenched so tightly it feels like it's tearing apart. That is a classic sign of magnesium deficiency. In Canada, integrative doctors have successfully used magnesium glycinate or magnesium citrate supplements to reduce leg cramps, restless leg syndrome, and post-exercise muscle tightness. In the United Kingdom, research has confirmed that pregnant women and elderly individuals are especially vulnerable to low magnesium levels, and supplementation has been shown to dramatically reduce the frequency and intensity of cramping. Australians dealing with high summer heat and electrolyte loss are also encouraged to boost magnesium intake through food sources like spinach, pumpkin seeds, and avocados, along with supplementation. Yet most people in the United States reach for electrolyte drinks that are heavy in sugar and sodium but low in magnesium. The result? Persistent leg cramps that get labeled as random, when in reality they are highly predictable based on magnesium status. Magnesium is often referred to as nature's muscle relaxant for a reason. It helps muscles release, unwind, and recover. Calcium is a well-known mineral, but its importance in preventing leg cramps is often misunderstood, especially in the context of how it works together with magnesium, vitamin D, and vitamin K2. Calcium plays a key role in muscle contraction, but a proper balance is absolutely essential. Too much calcium without enough magnesium or D3 can actually lead to increased cramping. In the United States, many people oversupplement with calcium due to fear of osteoporosis, but without the supporting nutrients, this can trigger nerve excitability and muscle spasms. In emergency rooms across the United States and Canada, patients frequently arrive with symptoms like muscle twitching, foot cramping, or calf spasms. Vitamin E is typically thought of for its skin and antioxidant benefits, but its connection to leg cramps is very real. In several clinical observations from the United States, vitamin E has been shown to improve circulation, particularly in people with peripheral artery disease, a condition that often leads to leg pain and nighttime cramping. Vitamin E helps prevent oxidative damage to blood vessels and red blood cells, both of which are crucial for proper oxygen delivery to muscle tissues. When muscles are deprived of oxygen, they fatigue faster and are more prone to spasms. In Canadian studies, older adults and diabetics suffering from frequent leg cramps saw improvements after incorporating mixed tocopherol forms of vitamin E, not just the synthetic alpha tocopherol found in many cheap supplements. In the United Kingdom, there's increasing interest in vitamin E's role in managing vascular conditions that contribute to leg cramps in aging populations. Meanwhile, Australia has seen success in using tocotrienols, more potent forms of vitamin E, in individuals suffering from muscle tightness due to poor circulation. In the United States, vitamin E deficiency is uncommon in the general population, but poor absorption due to gut issues, liver problems, or high oxidative stress levels can create functional deficiencies. What's often missed is that people who follow extremely low-fat diets, still common due to outdated guidelines, may not absorb enough fat-soluble vitamins like E, which require dietary fat for proper uptake. Without adequate vitamin E, the vascular system begins to break down, leading to restricted blood flow and painful muscle spasms. Vitamin B6, also known as pyridoxine, is absolutely critical for amino acid metabolism, neurotransmitter synthesis, and the production of serotonin and dopamine, chemicals that affect both mood and nerve sensitivity. A deficiency in B6 can result in heightened nerve irritability, which often presents as twitching, tingling, or spontaneous muscle cramps in the legs and feet. In the United States, B6 deficiency has been observed in people with chronic stress, alcohol use, or long-term use of medications like birth control pills or certain antihypertensives. Canadian researchers have documented cases where severe leg cramps in pregnant women or menopausal patients were relieved after correcting B6 levels. In the United Kingdom, neurologists have emphasized that B6 plays a key role in controlling nerve excitability and that both deficiency and excess can cause neuropathic symptoms. That's why dosage matters. Too little and your nerves suffer. Too much, and it can lead to toxicity. Australia's clinical nutritionists often use activated forms of B6 like P5P, pyridoxal 5-phosphate, in people with methylation issues or liver impairment, because it's more readily absorbed and utilized by the body. Yet in the United States, many over-the-counter B-complex vitamins include synthetic forms of B6 that are poorly absorbed, leaving people unaware that they're still functionally deficient even while supplementing. Nighttime leg cramps, burning sensations, or electrical shock-type nerve spasms can all be signs of a B6 imbalance that needs immediate correction through the right form and dose of this essential vitamin. Potassium is a well-known electrolyte involved in muscle contraction, and low potassium is one of the most common causes of leg cramps, especially in athletes and people using diuretics. In the United States, potassium deficiency is widespread because of the overconsumption of sodium and underconsumption of fresh fruits and vegetables, which are the primary sources of potassium. Potassium helps regulate fluid balance, nerve transmission, and muscle contraction. And when it drops, nerves can begin misfiring, leading to intense muscle spasms. In Canada and Australia, health authorities emphasize potassium intake as a public health priority, not only for heart health, but also for cramp prevention. In the United Kingdom, potassium-rich diets have been associated with lower incidence of hypertension, stroke, and muscle-related complaints, including nighttime leg cramps. Unfortunately, in the United States, most people don't meet even half the recommended daily intake of potassium, and many are unaware that medications like blood pressure pills, corticosteroids, and even laxatives can deplete potassium levels rapidly. Foods like avocados, bananas, spinach, sweet potatoes, and coconut water can dramatically help, but in cases of severe deficiency, supplementation may be necessary. However, potassium supplements are tightly regulated in the U.S., and most over-the-counter forms contain only small amounts, far below what's needed to correct a real imbalance. That's why understanding the role of this vitamin-like electrolyte in your leg cramps is vital, especially if you're dealing with chronic muscle tightness, fatigue, or spasms that don't respond to stretching or hydration alone. Vitamin K2, often overshadowed by its more commonly known cousin K1, plays an essential role in calcium regulation within the body, and this has a direct effect on preventing leg cramps, especially those related to vascular issues or muscle stiffness. Unlike vitamin K1, which is mostly involved in blood clotting, K2 directs calcium into the bones and teeth where it belongs and keeps it out of soft tissues like arteries and muscles. When calcium deposits in the wrong places, especially the blood vessels, it can lead to stiffness, poor circulation, and chronic cramping in the legs. This issue has been seen in countless cases across the United States, where vitamin D and calcium supplements are overused without adequate K2, leading to calcium misplacement and increased leg pain. In Canada and the United Kingdom, researchers have started identifying low K2 levels in patients suffering from vascular calcification and peripheral artery disease, both of which are linked to reduced blood flow and higher risk of nighttime cramps. In Australia, clinicians treating patients with bone loss or muscle tightness often recommend K2 in the form of MK7 or MK4, which are the most bioactive forms. Yet in the United States, K2 is rarely included in standard multivitamins, and few doctors test for it, despite its profound impact on muscle relaxation and vascular flexibility. People with diabetes, kidney disease, or chronic inflammation are especially prone to K2 deficiency and often experience deep leg aches, spasms in the calves, or even foot cramps due to this silent imbalance. What is alarming is how many of these people are misdiagnosed with neuropathy or circulation problems when their arteries are simply calcified from years of unbalanced vitamin intake. Vitamin C is often praised for its immune-boosting effects, but its importance in collagen synthesis and connective tissue repair is what makes it a key vitamin in preventing leg cramps. Muscles don't operate in isolation. They're supported by ligaments, tendons, and vascular tissue, all of which rely on collagen for flexibility and strength. Without enough vitamin C, these tissues weaken, leading to inflammation, micro-tears, and increased vulnerability to cramps and spasms. In the United States, diets heavy in processed foods often fall short on vitamin C, and while outright scurvy is rare, functional deficiency is common, especially in people who smoke, drink alcohol, or live with chronic stress. In the United Kingdom, studies have shown that vitamin C deficiency contributes to joint pain, poor healing, and muscular fatigue, particularly in older populations. Canadian researchers have highlighted its role in reducing oxidative stress and promoting faster recovery in athletes who frequently suffer from muscle cramping after intense workouts. In Australia, vitamin C supplementation is used alongside magnesium and potassium to enhance muscle repair and blood vessel health. Many Americans still rely on vitamin C from fruit juices loaded with sugar, but what they don't realize is that this sugar actually competes with vitamin C for absorption due to their similar structure. This means that even if you're getting some vitamin C, your body may not be using it effectively, especially if your blood sugar is elevated. The result? Stiffer muscles, fragile tissues, and more frequent cramping, especially in the calves and hamstrings. Folate, or vitamin B9, is crucial for red blood cell formation, DNA repair, and the methylation process that affects nerve health and muscle performance. A deficiency in folate can lead to muscle fatigue, leg pain, and an increased risk of cramps due to impaired oxygen transport and poor cellular repair. In the United States, many people assume they're getting enough folate because it's added to enriched grains, but synthetic folic acid is not as easily converted by the body into its active form, especially in individuals with MTHFR gene mutations. In Canada, folate is often overlooked in patients with chronic pain and muscle issues, yet supplementation with methylated folate has shown significant improvement in muscle relaxation and energy production. The United Kingdom has started to recognize the importance of active folate in populations with anemia-related fatigue and muscle cramps, especially in pregnant women. In Australia, nutritionists stress the importance of leafy greens, legumes, and liver as natural sources of folate for people struggling with poor circulation and exercise intolerance. The tragedy in the United States is that many people are unknowingly folate deficient while consuming fortified foods that do little to correct the actual problem. Meanwhile, their legs ache, their energy drops, and they chalk it up to aging or poor fitness, not realizing their body is literally starved for the building blocks of muscle function. Iron is another often ignored contributor to leg cramps, especially among women, athletes, and individuals with digestive or menstrual issues. Iron deficiency leads to decreased hemoglobin production, reducing the oxygen-carrying capacity of red blood cells. When your muscles are starved of oxygen, they contract poorly, fatigue faster, and become more susceptible to spasms and cramps, particularly in the legs, where circulation must work against gravity. In the United States, iron deficiency remains one of the most common nutritional deficiencies, particularly in adolescent girls and women of childbearing age. Canadian clinics often screen for ferritin,